Ever wondered what pneumonia is and how it impacts our lungs? Pneumonia is an inflammatory condition that primarily affects the tiny air sacs in our lungs, known as alveoli. This inflammation can be triggered by a variety of infectious agents, including bacteria, viruses, fungi, and even parasites. Now, why should we care about pneumonia? Well, it's a significant global health concern. Every year, millions of people worldwide are affected by this lung condition. The severity of pneumonia can vary widely, from mild cases that resolve with proper treatment to severe instances that can lead to potential complications, even death. And here's the kicker: pneumonia isn't just one disease. It's actually a whole class of lung conditions, each with different causes, symptoms, and treatment strategies. So the next time you hear about pneumonia, remember this: pneumonia isn't just one disease, it's a whole class of lung conditions. Pneumonia, it turns out, comes in different forms. Let's dive right into the four main types. First up is community-acquired pneumonia, or CAP. This is the kind you catch outside of hospitals or healthcare facilities. The usual culprits here are bacteria like Streptococcus pneumoniae, Haemophilus influenzae, and some atypical ones like Mycoplasma pneumoniae. Next, we have hospital-acquired pneumonia, or HAP. As the name suggests, this one develops more than 48 hours after you're admitted to a hospital. It's often associated with more resistant bacteria, such as the notorious MRSA, methicillin-resistant Staphylococcus aureus. Then there's ventilator-associated pneumonia, or VIP. This occurs 48 hours or more after endotracheal intubation, which is a fancy way of saying putting a tube down your throat. The usual suspects here are hospital-acquired bacteria, including Pseudomonas aeruginosa. Finally, we have aspiration pneumonia. This one results from inhaling foreign material, like food, saliva, or gastric contents. It's often seen in individuals with impaired swallowing or consciousness. Each type of pneumonia has its unique causes and challenges, but they all share one thing in common: they're serious conditions that can lead to severe complications if not promptly and properly addressed. So, whether it's CAP, HAP, VAP, or aspiration pneumonia, it's essential to understand the differences and approach each one with the right strategy. Certain factors increase the risk of contracting pneumonia. Do you know what they are? Age is one, with very young and elderly individuals more susceptible due to their weaker immune systems. Speaking of which, a weakened immune system, whether from conditions like HIV/AIDS or treatments like chemotherapy, also increases vulnerability. Chronic medical conditions such as chronic obstructive pulmonary disease, asthma, diabetes, and heart disease are also risk factors. Smoking is another culprit, as it damages the respiratory system and weakens immune defenses. Malnutrition, too, can compromise your immune system and overall health. Hospitalization exposes individuals to hospital-acquired infections, and conditions leading to impaired swallowing or altered consciousness can increase the risk of aspiration pneumonia. Now, let's move on to diagnosis. Pneumonia is typically diagnosed through a clinical evaluation, where symptoms like cough, fever, chest pain, and difficulty breathing are assessed. A physical examination and review of the patient's medical history are also important. A chest X-ray can help identify the presence and location of infiltrates or consolidations in the lungs. Blood tests, such as a complete blood count and blood cultures, can identify the causative agent. Sometimes sputum is collected and analyzed to identify the specific pathogen. In some cases, a bronchoscopy, an invasive procedure to visualize the airways, is needed to collect samples for testing. Management of pneumonia often starts with antibiotics, initiated empirically and adjusted based on culture results. Antiviral medications are used for viral pneumonia caused by influenza or other viruses. Supportive care, including oxygen therapy, hydration, and pain management, is crucial. Hospitalization may be required for severe cases, particularly in older adults or those with underlying health issues. Early and accurate diagnosis is key to effective management of pneumonia. Remember, it's not just about treating the infection, but also managing the symptoms and any complications that may arise. The goal is to help the patient recover and prevent the disease from progressing to a more severe state. Pneumonia, if left untreated, can lead to serious complications. These can include respiratory failure, where the lungs can't provide the body with enough oxygen; sepsis, a dangerous infection that can spread throughout the body; a lung abscess, which is a collection of pus in the lung tissue; pleural effusion, or fluid buildup around the lungs; acute respiratory distress syndrome, severe lung damage leading to respiratory failure; and organ failure, where pneumonia affects other organs, leading to multi-organ failure. Proper management and treatment can help avoid these severe complications.